Dr. Jim Turpin founded Project-Concern-International in 1961 to help the global poor. Motivated by our concern for the world's most vulnerable communities, PCI envisions a world where abundant resources are shared. A world where communities provide for the health and well-being of their members, and children and families can achieve lives of hope, good health, and self-sufficiency. At PCI, our work is fueled by the belief that we could break the cycle of poverty and poor health by addressing the root cause of disease, malnutrition, and economic insecurity. Our mission is to prevent disease, improve community health, and promote sustainable development worldwide. We are currently managing over 60 programs in 16 countries, and as part of our most aggressive strategic plan in PCI's history, our goal is to change 10 million lives in the next 3 years. We plan to do this through increased programming in gender equity, local partnerships, and sustainable programming. But private support is critical to do this work. We know that the ability to measure the real results and impact of our work, not just the activities, is critical to justify investment in our programs and in our organization. Our unique Live Change Indices measures our program's impact on social, emotional, and economic levels. This allows us to measure the true, deep impact of our work, not only with a single indicator, but on multiple levels, including income, education, health, and social empowerment. We are one of only 16 nonprofits that have received Charity Navigator's 4-star rating 3 years in a row. This distinction is given to organizations that demonstrate extreme fiscal responsibility. PCI is committed to sustainable change in the health and self-sufficiency of people living in acute poverty. We believe the only way that this is possible is by strengthening the local organizations we partner with in the countries where we work. This capacity building is a key component of all our programs, and PCI is known for this work throughout international development arenas. This is an essential strategy for ensuring the sustainability and scale of our projects, so local citizens can carry on the work after we leave. While PCI has an overall goal of reaching 10 million people by 2015, each of our 60 programs has specific data requirements that monitor the success of the work. For example, with our Anti-Violence Against Women program in South Africa, we reached 3.6 million people with our public awareness campaigns. On a very different program, our polio immunizations in India, we were able to eradicate polio in a target area over a 10-year span. Each program has its own metrics, and our monitoring and evaluation team is continually researching the efficacy of each program. Additionally, our Lives Changing Indices is a layer of analysis we've added to measure the social and emotional impact of our work on the lives of those we serve. Because of the diversity in the work we do, PCI's groundbreaking work can be overshadowed by larger organizations. For example, our approach to disasters is not so much on relief as it is on rebuilding, which tends to get less press because it happens in the years following a disaster. Our rebuild of a neighborhood in Haiti used a model of partnering with a cross-section of local entities. It is now heralded as a model for global disaster relief. And now we are duplicating that model in Guatemala and Indonesia. Through a recent $15 million grant from the Bill and Melinda Gates Foundation, we've been able to expand our work in the poorest regions in India, reaching populations left far behind by other services. These marginalized people, often ostracized as untouchables, are now learning about basic sanitation and nutrition, and gaining access to public services they were not previously aware of. Through another recent grant, PCI is expanding its groundbreaking Women Empowered initiative, a microsavings model that is thriving in communities around the world. This model uses the participants' own funds to create capital to invest in micro-enterprises. It's transforming the lives and communities in these very poor regions. Many of PCI's projects are large-scale commodities projects, like school feeding programs. And because of this work, we are largely funded by government grants. And changes in elected officials and political philosophies or government budget challenges leave us vulnerable. Because most of our programs are outside the U.S., we also struggle to raise funds with a public that seems largely interested in U.S.-based charitable efforts. The public could feel disconnected with the issues of global poverty and not sure how their individual donations or efforts can ever make a difference. We are challenged to make these causes real to the public and personal enough to show that their efforts are really changing lives. PCI's current strategic plan includes expanding and promoting our programs in gender equity and building the capacity of local NGO partners. We have proven successes in these areas and have plans to increase the marketing and awareness of these models to the development community. In addition to giving PCI valuable exposure and positioning us as a leader in international development for these areas, these models can serve as useful tools to help other nonprofit organizations do their work more effectively. Additional resources would enable us to accelerate these plans. In global development, we rarely have the chance to revisit our programs long after we've gone and see how they're doing. Are they still going? What is the long-term effect of the community? What has the change been? This is critical to our work, but program grants don't include funding to do this work. The funding usually covers just the cost of implementing the program. Additional resources would allow us to expand this capability, measure the long-term change over time as a result of our work, and help us use that learning to craft and improve new programs.